is Sinead Delany-Moretlwe. I'm a research professor at Wits and director of research at Wits RHI, an institute in the Faculty of Health Sciences.
Hi, I'm Danielle Travill. I'm a research clinician in the research division at Wits RHI.
Sexually transmitted infections are a global public health problem. About 1 million curable STIs are diagnosed every day. In sub-Saharan Africa, young people in particular bear a significant burden of sexually transmitted infections. One of the challenges, or one of the reasons for the high rate of STIs, is that often these STIs they have no symptoms, or the symptoms are not recognized, and so people don't seek treatment. But the problem is if STIs are left untreated, they can lead to significant complications, particularly in women and their infants. So things like ectopic pregnancies, infertility, chronic pelvic pain, and also problems in infants. They can experience blindness and other problems if they are infected with STIs when their moms are pregnant with them. So STIs are a real concern. Have become even more of a concern, given that we have about 78 million cases of gonorrhea a year globally, and the WHO has made gonorrhea a priority because we're running out of antibiotics to treat gonorrhea, and obviously what we don't want is an uncurable STI. So the way that we treat STIs in South Africa is really to recognize symptoms. And I think that that's the problem I've just pointed out. Many times people don't have any symptoms, or they don't recognize that these are symptoms of an STI. So a lot of people don't seek treatment. But if someone has complaints in the genital area, then they can go to any public health clinic and they can seek treatment. And generally what would happen is that they'll get antibiotic treatment for any of the bugs that cause those symptoms. Now, for many people, especially young people, going to a clinic to talk about your sexual health can be a bit of a challenge. And that's another reason why we have such high rates of STIs, is that STIs are stigmatized and people often feel uncomfortable talking about sexual health to some of their healthcare providers. But it's really important to seek treatment because of the consequences of untreated infection. So Wits RHI has been involved in the field of sexual and reproductive health research for a long time. We have done work showing that young people, particularly those accessing PrEP services, are at much higher risk of sexually transmitted infections. And that's prompted us to get much more involved in activities aimed at strengthening STI control programs in South Africa. One of the things that we've got involved in recently is a trial of a new antibiotic for the treatment of gonorrhea because of the concerns of antimicrobial resistant gonorrhea. And so that is a study that is starting now, and which will include the offer of free screening for STIs for people who think that they have STIs.
So common STIs present with either, the two most common symptoms of STIs are a discharge, so genital discharge, either vaginal discharge or urethral discharge in men. Associated symptoms can be low abdominal pain, pain during sexual intercourse, and sometimes bleeding. Another common symptom are genital ulcers, and so these are sores either on the penis or on the vagina. Those are the most common symptoms, but as Sinead previously mentioned, most of these STIs are commonly asymptomatic, meaning that they present with no symptoms at all despite having the infection. So outcomes of untreated STIs can include adverse effects on sexual and reproductive health, including ectopic pregnancies, pelvic inflammatory disease, and chronic pelvic pain in women. STIs have also shown to increase the risk of HIV acquisition. So leading up to STI and Condom Week, Wits RHI, as part of one of our studies, will be offering free STI screening for chlamydia and gonorrhea through a urine STI test to all individuals who are looking for it. So if you're interested in getting tested, please get in touch with us with the details below.
Okay, so Wits RHI has been involved in the field of sexual and reproductive health for 25 years. But recently, the expanding access to PrEP, that's pre-exposure prophylaxis for HIV prevention, has really shone a light on the high rates of STIs, particularly in young men and women accessing PrEP services. And that has sort of raised the priority for STI research. So research that focuses on new strategies to diagnose STIs, so no longer relying on symptoms, but actually using laboratory tests to diagnose STIs. Looking for new treatments, so new antibiotics. We're involved in a new trial of an antibiotic called zoliflodacin, which would treat resistant gonorrhea. And then ultimately a goal of identifying vaccines that could be used to prevent particular STIs like gonorrhea. So there is interest in vaccines against gonorrhea, but we also have had a long-standing piece of work around vaccines for human papillomavirus, which is one of the most common sexually transmitted infections and causes cervical cancer. Since 2014, the South African government has had an HPV vaccination program, and Wits RHI is involved in evaluating the impact of that program in populations of young people who may or may not have been vaccinated.